British doctors have developed a new technique that uses the body's own tissue to seal a hole in the heart. Now, 1 in 4 Britons are born with the condition, which heals naturally after birth. But for patients whose hole in the heart doesn't heal on its own, well, the new device will mean a less invasive procedure and quicker recovery. Dr. Iqbal Malik is a consultant cardiologist at St Mary's Hospital here in London. He's been trying out the new device, trialling it with his team for the last year. Thanks very much indeed for coming in. First of all, that statistic's quite staggering, isn't it? 1 in 4 of us born with a hole in the heart. Just what does that mean? I mean, it sounds quite alarming, actually.
Well, it's actually a natural finding. You can't have an abnormality in 1 in 4 people, and it's very important for us when we're in the womb. You don't use the lungs, and this is the bypass valve, so that blood can circulate using the placenta as the way of oxygenating blood. And bypass the lungs because they're full of fluid anyway inside the womb. As soon as you take your first breath, this flap, because it's not really a hole, it's a flap, shuts. And in 3/4 of people, it seals completely, whereas in 1/4 it remains open. Now, of course, it doesn't mean that 1/4 of people need this hole closed, but there are associations with conditions like stroke in a young age or decompression illness, the bends in divers, and even perhaps with migraine, which we're looking at. And so it's in those types of people where we should consider closure, and nowadays we would do it with an umbrella device.
Right, now, let's talk about that. That is a new device, a new technique that you've been trying out for the last year or so. Just explain, you brought in a rather fearsome-looking implement here, which I'm slightly worried about, but anyway, just talk us through how you do it.
OK, well, so the old way of doing it was obviously to have an open operation. There are a number of different devices available. What's different about this particular one is that it's made of collagen, which is a natural substance, and it can dissolve. So once it's done the job, it uses the body's own healing response and then disappears.
So how does this work then?
So I've got this device here, and I'm going to use your fingers as my surrogate for the hole in the heart.
So that's the hole. That's the hole there, yes.
So we've plugged this through, and I've placed my plastic pipe through the hole. Now that's slightly fiddly, but it's achievable.
Right.
Once we've got it through, what I'd like you to imagine is a double umbrella.
Yep.
And what I'm going to do is push forward the first part of the umbrella. So here it comes. And there's the first part of the umbrella.
You can just see it there, where my finger is. There's the little umbrella. It's quite big, actually, isn't it?
It's a reasonable size. Most holes, these flaps, we can stretch up to about 10 millimetres, but what we want is a device that produces full coverage. The septum itself is up to about 40 millimetres in an adult. So this is, although this is a 28 millimetre device, it's not going to touch the corners, as it were. It's just going to hit the middle area, which is where the hole is. So now I'm going to ask you to just let this device slip through. So keep your fingers there, and we're going to pull against there. You'll feel a bit of a tug. And what I'm going to do is tug against here, and you'll see a second umbrella deploying on the other side of your fingers. And you can see it.
Now, if I just turn it over, I think
you can see it actually clip.
That's the second umbrella there.
So now we've sandwiched the hole.
Wow.
And then what we're going to do is we're just going to release the device. It comes on a little stalk, and so I'm going to release it. And now there it is, in place, inside your heart.
Right. Left
there. And the advantage of the new device, because this is the older version which has cloth, the new device is made of collagen. I say that disappears. About 95% of it vanishes once the healing response that your own body has seals the hole.
Well, I'm afraid we've run out of time, but Dr. Iqbal Malik, that was fascinating. I feel like I've been operated on, actually. Successfully, I hasten to add, on my 2 fingers.